Hello friends, today we are going to discuss regarding treatment of diastolic heart failure. Now, diastolic heart failure is also called as heart failure with preserved ejection fraction, in which the heart muscle becomes stiff and is unable to relax properly, so that there is impaired filling of the heart. However, pumping capacity is preserved. We are going to discuss treatment of diastolic heart failure under the following headlines. Number 1, lifestyle modification. Number 2, pharmacological therapy. Number 3, treatment of comorbidities. Now coming to first, lifestyle modification. As we have already discussed, there are certain lifestyle modification that every heart failure patient is supposed to follow, which may include: number 1, salt intake should be less than 2 grams per day. Number 2, water intake should be less than 2 liters per day. Number 3, optimization of blood pressure, glycemic control, and cholesterol level should be accomplished. Now coming to pharmacological therapy. So basically now there are two main objectives when it comes to treatment of diastolic heart failure patient. First is to control symptoms of fluid overload. Second, to prevent tachycardia and control heart rate. Now coming to first objective, that is to treat symptoms of fluid overload. So drugs that are used to treat fluid overload may include: number 1, diuretics. So diuretics are used mainly to control symptoms. For example, dyspnea and fluid overload, pedal edema. However, we should use diuretic carefully. There is word of caution here, as excessive use of diuretic may cause reduced preload, which will lead to further worsening of heart failure, as it will lead to reduced cardiac output. Now coming to second, pharmacological therapy, which is usage of ACE inhibitor, ARB, ARNI. So how does ACE inhibitor, ARB and ARNI help in a patient with diastolic heart failure? So coming to first mechanism, neurohormonal blockade and reduced fluid retention. As we know that in a patient with heart failure, there is activation of renin-angiotensin-aldosterone system, due to which there is vasoconstriction, fluid and salt retention, and ventricular remodeling. Now these drugs basically causes blockage of renin-angiotensin-aldosterone system, thereby decreasing salt and water retention and causing ventricular relaxation. Second, ventricular relaxation and reversal of ventricular remodeling. These drugs decreases fibrosis and hypertrophy that takes place in the ventricle, thereby causing ventricular relaxation and reversal of ventricular remodeling. Drugs such as ARNI, sacubitril, inhibits neprilysin, which leads to release of peptide like ANP and BNP, which causes diuresis, that is water loss, natriuresis, that is salt loss, vasodilation and antifibrotic effect. It is much more superior in comparison to ACE inhibitor and ARB in improving symptoms and reducing hospitalization. Now third category of drugs include SGLT2 inhibitor, for example dapagliflozin and empagliflozin, and mineralocorticoid receptor antagonist, that is spironolactone or eplerenone. These drugs are known to reduce hospitalization in cases of diastolic heart failure. Now coming to second objective, which is basically reduction in tachycardia and control of heart rate, for which beta blockers are used. Beta blockers, mainly carvedilol, metoprolol, bisoprolol. They reduce heart rate, they slow down the heart rate to allow adequate filling of the ventricle and increasing cardiac output. Now coming to management of comorbidities. Patients with comorbidities, for example atrial fibrillation. So rate control or rhythm control leads to improved ventricular filling and increase in cardiac output. Second, in patients with ischemic heart diseases, revascularization therapy can be helpful. Third, in patients with obesity or sleep apnea, regular aerobic exercise, weight reduction programs can be of great help. Thank you.